So TACT-D is one of the first randomized evaluation of application of ctDNA in monitoring disease in metastatic colorectal cancer. The reason for designing this study was essentially centered around the fact that many salvage lines of treatment after first and second line of chemotherapy have very limited response rates, modest benefits in survival, but they have high toxicities. So if you can monitor these patients and look at early dynamic changes in ctDNA, there is a possibility of changing treatment early to allow less toxicity and exposure to progressors. This also would allow moving them to subsequent lines of treatment or referral to clinical trials. So the study had two different arms. One was a standard of care arm where everybody got ctDNA testing between cycle 1, day 1 and cycle 1, day 15, and then scans routinely, which we do every 2 months. And then there was a randomized arm where there was an early look at the ctDNA, and in case of a ctDNA progression, we were doing early restaging and switching therapy. What we found were very interesting results. Contrary to what is expected on the clinical scale, we found that majority of patients actually had a drop in their ctDNA after exposure to these agents, which classically, Regorafenib as well as TAS-102 have response rates of less than 2%. However, more than 70% of patients had some drop in their ctDNA. We also found that although that change from cycle 1, day 1 to cycle 1, day 15 was not predictive of PFS, OS, and objective response rates at the get-go, once you adjust it for other prognostic variables, it became an important predictive biomarker. And one of the most important predictive biomarkers for these clinical outcomes was actually baseline ctDNA. So you had to adjust this. So I think it was a very impactful and learning experience for us, because we want to keep trying to refine how to use these ctDNA applications. And there are lots of new steps that we are planning subsequent to that study.